All right, thank you for staying with the Monday Report. I believe we'll squeeze in one lucky caller to ask the questions at this panel and separate fact from fiction and see what happens there. Let's see another one here. Can one piece of soap be used by more than one person in the house and still stop coronavirus?
Yes, if you clean your hands properly, the soap should work, because you are using the foam that comes from the soap to destroy the virus together with the water. So yes, water and soap used properly will work.
Dr. Umoluga, are we as black people resistant to the virus?
Of course, the cases in Kenya have confirmed not. We are not. And, unfortunately, we are not resistant. And I think I explained this also on Wednesday. And Masika said that the coronaviruses are in a family. And the one that we are seeing now is just a special strain that we've never seen before. But we have seen 4 others before that have been circulating. So part of the normal cold that you've been getting is they are caused by many viruses, but part of what causes them is the coronavirus, as part of that family, you know. I think it's been difficult to explain. So if you can get normal cold, you can get coronavirus. So you are not immune to it.
Okay. And those who recovered from COVID-19, that's Victor Peter. That question, I believe, was answered already. What have they done to be clean? When can they get infected again? I think you'd already answered that question. Let's see, there's more here. Where did coronavirus originate from and what caused it?
I will say 2 things. One is that when we studied the genome of this virus, we see that it may have started in a bat, crossed into an animal called a pangolin, which is one of the most trafficked animal across the world, meaning there's enough contact between man and the animal, and then cross into humans. But our house is on fire. This is not the time to ask where the fire started from. We need to put it out first, then we can start asking those questions afterwards.
Kinywa from Ruiru is asking if COVID-19 infects a patient with an autoimmune disease disorder like lupus.
Yeah, I think that's part of what we have said. If your body is already fighting another disease, then you are more at risk in terms of getting a severe infection. So as you've seen, for example, other countries, they are very aggressive in advising patients or people who are already battling other problems to really stay away, to take very strict measures. In fact, in some places, they are literally quarantining the people who they think are at most risk. Those are the people who are already sick, or the elderly, which they are defining as above 70, or in some cases, although I think this has also not been proven, pregnancy also, I think, was
that was
initially
another question about pregnant women and whether it can be transmitted through breast milk.
Yeah, so pregnancy was categorized. I think it's not really necessarily through the breast milk. It's that when the baby is breastfeeding, there is very close contact between the mother and the baby, and when the mother is either coughing or touching the things, then it's possible that the baby will contract the virus.
Gentlemen, I'm running out of time here, but Dr. Masika, I'll give you a minute to answer. We are here now. What do we do?
I think we all need to be ready to make the adjustments that are necessary to protect ourselves and others. And I say that because we are now seeing an increasing risk week by week. As the risk increases, the measures we take will also increase. That means we may need to adjust our social life, our work life, all our lives, so that we don't expose ourselves or expose others. And when we are called upon, we need to be ready to make that sacrifice so that everyone is safe. The messages that we've been giving people for cleaning your hands, cleaning surfaces, social distancing need to be taken seriously because they've been shown to work. Let's not wish them away or to see adarau. Let's take them seriously.
All right. And Simon Magak says it is true that prevention is better than cure. When the first coronavirus case was reported, we could still see flights from China landing at JKA. Can we say that the government had failed in their duties and they are now trying to collect already splashed water? And then he asks, how can one differentiate between corona and normal common cold? As you also tell us what you'd like to see in the medical field now to ensure that we fight this coronavirus appropriately. What are the missing gaps? What should the government do?
Okay, yeah, so I think in line with that question, it's true that there was a bit of laxity from the beginning, but over the last 2 weeks, we must give government credit for trying. Of course, that's not 100%, and especially for me, speaking on behalf of health workers, there's a lot of gaps. Health workers have not yet been sensitized. The clinicians are still struggling to put the management protocol so that tomorrow, whether you are in a dispensary in Nyakemincha or you are in Mandera or somewhere in Mombasa, you know very well that this is the protocol for management, this is the protocol for testing, this is the protocol for diagnosis, the protocol for isolation, and so forth and so on. But more importantly is that health workers must be protected. I think they are the army that we have. Right now, we are in a war situation, and the country must know that your own protection, your own defense depends on that nurse, that doctor, that clinical officer, that laboratory technician, the watchman in the hospital. That is our own protection. If you want to come out of this lockdown in this quagmire, these are the people that we must look at right now, and we must protect them first. So we must give them masks, we must give them gowns, we must give them disinfectants, we must make sure that they have gloves, we must make sure that they are holding rooms, we must make sure that there are specific facilities that the health workers who will get sick are treated. And I think what has happened in China and even in Italy is that they have taken specific isolation facilities for health workers. If you see 20% of health workers who get into contact with the patients, irrespective of those precautions we've talked about, get sick. So of course, some of them mildly, but it's important, and some of them have died. So it's a very serious thing, and today I think that has come out quite clearly. And then lastly is to make sure that we employ more health workers. We have said, I think there are thousands of doctors outside there, and we will work very closely, because I have mentioned that most of these health workers, if we go into a crisis, will be quarantined themselves. So we're already having a severe shortage, and I think the president recognized that very well, and we want to thank him for giving a directive that we employ health workers. So we will be pushing the Ministry of Health and the county governments to at least absorb the 3,000 doctors and thousands of other nurses that are there for a period, so that should we go into a crisis and we have to quarantine other health workers or give other health workers a break, we have a reserve of health workforce. And this is also important for UHC. I think the one thing that this pandemic should teach us, that healthcare is as important as our security. In fact, if not more important, because if we do this pandemic right, then whatever happens in the future, we will always get it right.
All right. Thank you so much for making time this evening. Dr. Uma Oluga, KMPD Secretary General, and Dr. Moses Masika, Virologist at CAVI ICR, which is the Institute of Clinical Research. And thanks for making time and answering all the questions. Like I told you earlier on, we will be with you until we fight this pandemic to the end, and I assure you, we will win at the end of it all. For now, keep a 1 meter distance. Wash your hands as regularly as possible. Use the sanitizers as much as you can. Avoid handshakes, all right? Avoid handshakes, tafadhali. Avoid handshakes and avoid hugs as well. I see there's an improvised version of greeting on the side. Is that even required though? Because they said that also the best way of coughing is this. So then you're closer to the particles, right? You know?
and this is if you don't have a tissue that you can dispose of.
So it's supposed to be a tissue, not even a handkerchief.
Not handkerchief.
Unless you're willing to dispose of that handkerchief. I did mention earlier on that you can use your handkerchief, but now the experts are saying it's disposable tissue, not your handkerchief. All right. Thank you so much. And I assure you will still have these conversations and answer all your questions right here on Citizen TV. My name is Trevor Mbija. Again, do not be scared. We will win this. I guarantee you. All right? Good night for now.